Hi guys, Carrie here. Hey, I'm on my 30-month update of reversing my previous extraction orthodontic treatment. Also, it's my second tray of Invisalign. I put in the second tray on Thursday night last week. Today's Sunday. Um, to be honest, it really wasn't painful at all. After I left you on the last video, I talked about how I didn't think it was going to hurt at all. Actually, that next morning when I got up, I had pain in here and in here pretty bad. Um, but other than that, it wasn't too bad. So when I got my Invisalign, I didn't talk too much about the Invisalign actually in the last video. I kind of talked more about getting the braces off. So they gave me this like starter kit, and then I got the first two sets of trays. So I put in the first set that day, and then I changed over Thursday night. And to be honest, it didn't hurt at all, but then again, I don't really know because I put it in after I got back from the bar. Just being honest. Every once in a while, we all gotta have a life too. So I'll show you where my teeth are at now. With the Invisalign, it covers your whole tooth, and I think it actually covers a little of the gum in the back. Because when I take the trays out to brush, in here, on my front two teeth, I think something's pressuring or whatnot. My gums have been bleeding ever since I got these, and that was never the case before. Although I really do love being able to floss. There's a lot of pros and cons to Invisalign versus the ceramic braces, but I think I'm going to do a whole separate video on that because I didn't get the attachments yet. I'm going to get them on the 10th of March, so next week, Tuesday. So then I can really do a true pro and con video. So I guess I'm supposed to have 24 trays. I'm on the second set now. Oh, I just can't wait to be done, to be honest. I think it's helped a little bit with the flaring on the bottom. Oh, and also I am getting them in and out a lot easier now. I can take them in and out now without too much problem. So I think the center line and all is lining up a little bit better. No changes really in here. We weren't expecting it, so that's all pretty much the same. Um, Not a whole lot to say. I mean, there are definitely pros and cons to these things. I think the biggest problem I've had so far is like when you just have regular braces and like you're out with a bunch of friends and somebody's like, you want to try a peanut? You can try the peanut, but if you got these things, you're not going to take them out. Try the peanut and then find a toothbrush. I think that's probably been the most frustrating factor of them. That, and it does give you a speech impediment too. I mean, I'm the queen of gadgets in my mouth. I think I've been through almost all of it now between orthotics, expanders, full set of braces, now this. Um, it's kind of easier to get in and out, especially I think these have come back a little bit, and that's making it a lot easier for me to get them in and out. The first couple of days, I have to say about the third day I had them, the worst thing was it messed up my bite on this side. I had like that whole terrible TMJ headache going all the way up here. And I had the same problem with the bite blocks because anything that's unnormal, I think my body just my jaw just defaults to trying to bite backwards because of the force for so long from the pressure backwards from all the years of the extraction orthodontics and all that. Just trying to force everything backwards so much that I think that backwards is kind of ingrained in my head to bite backwards. But what I did was I kept training myself when I felt the pain coming on to be like, okay, reset. And sometimes I can reset my jaw a little bit on my own by opening my mouth real big and closing it real slow and just kind of seeing where it lands because that's where it's supposed to be. Uh, which is great. But if it gives me any hesitation, I know it's off track. Um, I'm going to talk to him about that next time, and I'm going to see if maybe we can get a coating of material over the lower so that it doesn't put the pressure to bite backwards on here, but that's definitely a negative for Invisalign. Um, At this point, if I had to say, I wasn't going to talk this much about the difference between the braces and the Invisalign, but at this point, if I had to say, I would just assume stayed with the braces because I was used to it. I had had them for so long. I kind of think that's why. But after my next appointment and I get the attachments, I was just watching actually somebody else's video and they got the attachments and they said it looked just like regular braces anyway. And I'm like, and the other thing is these things cover up both sides of your teeth, so I don't know. Oh, and the other thing is that recently they stink after about a week, and even if you brush them every day, they stink. And it tells you over here not to use Effort or denture cleaner. I just bought the denture cleaner, and I'm going to try it on the last set just to see what it does because it says it stains them and stuff. But I don't care. But that they just smelled like infection raunch breath, and I'm sorry, I'm not going to go around like that, especially in a professional environment at work. Okay, guys. Thank you so much for watching. Any questions, let me know. I guess this one was just a little bit more on Invisalign um and in these cases for the TMJ patients, I would not recommend Invisalign because it shuts your bite off again. So I'm just lucky enough that I know enough and I sat with a neuromuscular dentist for 48 hours and we went through everything, so I kind of know a little bit more than the average person on that. But most people, I think this would force your jaw back, at least if you came from the background as my case. Okay, guys, have a great night. Thank you so much for watching and hope you enjoyed. Aloha.